I'm going to show you how to use clinical note templates to create a note. In anesthesia, we want to make sure it's a safe event. A nurse can utilize clinical notes to build a note for an anesthesia review. In this case, she'll check progress note anesthesia. She'll change the author of the document to the anesthesiologist that is going to be reviewing the case more formally. When she does this, this will change the buttons to have submit as an option in the bottom. We'll talk about that more later. She'll add a subject line to the note, and here it's a pre-anesthesia note. There is a smart template that she can fire that is a preanesthetic note. It'll have little underlines, which by F3 it allows the nurse to forward to these areas, and in this case type in the operative procedure as the cholecystectomy, and F3 forward and state that the doctor requesting anesthesia is Dr. Hill. Now the allergies, surgical history, medical history, those all get pulled forward by smart templates inside this document. There's a red bold there to pay special attention to medical diseases that are associated with higher risk of anesthesia, and the nurse can get rid of that. Now here is another little bolded red text. By double-clicking on that, it can be erased, and the nurse goes down and reviews the EKG, in this case, finds the information and then adds this to the chart. There's not an echocardiogram or a chest x-ray, but the pulmonary function tests on chart review can be pulled forward and typed in as well. The lab used a double flash key, and when she F3s forward to this area and hits return, it gives many different options. By typing basic metabolic panel, this will pull the most recent basic metabolic panel into the note, and going down and double flash key, and then a CBC short will give the shortened CBC option. Now we get into the meat and potatoes of the anesthesia note. Here it has embedded multiple auto texts that give drop-down functions. For past anesthetic complications of the patients, we'll choose yes, which brings up another internal complication list to pick from. If a nurse doesn't wish to use it, she can always double-click onto these embedded auto texts and just type over the top of them, giving more details as she chooses. These highlighted red texts will lead the nurse through Mallampati scores and documenting NPO status prior to surgery. Just below the NPO status, we can see that the measurements are automatically pulled forward into the note. The ASA class is here, and I'm just going to show how if you hover over any of these options, it'll give more information. We'll choose an ASA physical status class 3, which is embedded into the note very cleanly. Under plan, we can F3 into the plan. Hitting return will allow us to select general anesthesia as chosen. Additional information we'll choose from the art line. It'll allow us to say yes or no. We can choose no and it'll disappear. There's no PA catheter in this patient, but CVP is required for this patient. Now the nurse has completed her part. She can push the submit button, which will place this note unfinished into the chart. Now it's time for the anesthesiologist to do his work, and he'll want to review that note, so he'll push modify when he's looking at that note. It'll open it up in his name, and he can review all the information that Cerner has automatically placed into this note, as well as all the information that the nurse has added in. And this exact note can be used in dynamic documentation, although it's limited because it doesn't have multiple authors yet. So clinical note template would work better, since you can have a nurse or someone else build the note for you, and then you can review it. In here, under informed consent, the anesthesiologist can review this and check the appropriate boxes, F3 again, into these underscores, and then add an X as they are. There's a remarks section so that the anesthesiologist can give further information. An anesthesiologist can be trained to use and build auto text of their own, in this case, a plan for pre-anesthetic evaluation. Once that's signed, it is delivered into Cerner for future reflection.